Hello and welcome, dear viewers. It's me again, your channel name. And today we're going to talk about a topic that many have heard of but often underestimate: Candida fungus, also known as candidiasis. You might have come across this name before, but you may not realize how common it is and the health risks it can bring. Candida is actually a type of fungus that naturally lives in our bodies, but under certain conditions, it can overgrow and cause various discomforts, and in some cases, even serious illness. It can appear as a white coating in the mouth, cause bloating and digestive issues in the intestines, lead to redness and itching on the skin, and in women, result in vaginal infections. In severe cases, especially when the immune system is very weak, Candida can enter the bloodstream and affect the entire body. In this video, we'll discuss what Candida really is, where it can be found, its causes, symptoms, and how to prevent it, all from a medical perspective. Make sure you watch until the end, because I'll also share practical, doctor-recommended tips to help you protect yourself from candidiasis. 1. What is Candida? Candida is a type of fungus yeast that naturally lives in the human body but, under certain conditions, can overgrow and cause infections. The most common species is Candida albicans. It can be found in healthy individuals in the mouth, intestines, genital area, and on the skin. But it usually does not cause harm if the immune system is strong. To where can Candida occur? Mouth, white coating thrush, or milk tongue appearance. Genital area, vaginal candidiasis in women, balanoposthitis in men. Intestines, dysbiosis and bloating. Skin and nails, redness and itching in moist areas. Bloodstream sepsis in cases of severely weakened immunity. Candida fungus origin and symptoms. 1. Origin etiology. Candida is a type of microscopic yeast belonging to the fungus family, most commonly Candida albicans, although other species such as C. glabrata, C. tropicalis, and others also exist. It normally lives as part of the human microbiota in the mouth, the intestines, the genital area, the skin surface. Disease mechanism: pathogenesis. Candida is usually harmless because a healthy immune system and balanced microbiota keep it under control. However, when this balance is disrupted, for example, due to dysbiosis or weakened immunity, Candida can multiply rapidly, invade tissues, and cause inflammation. 2 factors that trigger Candida overgrowth: weakened immune system, HIV/AIDS, diabetes, chronic illnesses. Long-term antibiotic use destroys beneficial bacteria. Hormonal changes, pregnancy, menopause, contraceptive pills. High sugar diet, glucose serves as a nutrient source for Candida. Stress and lack of sleep, humid environments, and poor hygiene. 3. Symptoms: clinical presentations. The symptoms depend on the affected area. Oral candidiasis, oral thrush. White, milk-like coating on the tongue and oral mucosa. Burning sensation, irritation, dry mouth. Pain or discomfort when swallowing. Vaginal candidiasis, intense itching and burning sensation. Thick, cottage cheese-like white discharge. Pain during urination or sexual intercourse. Penile candidiasis in men. Redness and itching of the glans penis. White discharge and inflammation. Cutaneous candidiasis. Red rash in moist areas: armpits, under the breasts, between toes. Small blisters or pustules. Systemic candidiasis: bloodstream infection, severe form. High fever. Chills, fatigue. Often life-threatening if untreated. Conclusion: Candida fungus normally exists in our bodies without causing harm. But when the natural balance is disturbed, it can become pathogenic and cause infections in various areas. While symptoms vary depending on the site, the most common are itching, white discharge, and inflammation. What to do if you have a Candida infection? 1. Get a proper diagnosis. First and foremost, visit a healthcare professional for an accurate diagnosis. Diagnosis usually involves a physical examination, and laboratory tests such as microscopy or cultures to confirm. Candida infection. To treatment. Topical treatment for mild cases, antifungal creams, ointments, or suppositories, for example, clotrimazole. Miconazole are commonly used. Systemic treatment for severe or recurrent infections. Oral antifungal medications like fluconazole may be prescribed. It is important to complete the full course of treatment as directed by your doctor. 3. Hygiene and prevention. Maintain strict personal hygiene, especially for the genital area and mouth. Wear loose, breathable clothing to reduce moisture. Avoid sharing personal items such as towels or underwear. For lifestyle changes, limit sugar and sweet foods, as Candida thrives on sugar. Eat a balanced diet and support your immune system. Manage stress and ensure adequate sleep. 5. Careful use of antibiotics and medications. Use antibiotics only when prescribed by a healthcare professional, since they can disrupt normal flora. Sometimes, probiotics may be recommended to restore healthy bacteria. Candida and climate connection. 1. Humidity and temperature. Candida and other fungi thrive in warm and moist environments. In hot and humid climates, especially tropical and subtropical regions, candidiasis is more common. Moisture on the skin and genital areas creates favorable conditions for infection. 2. Dry and cold climates. Candida infections are less frequent in cold climates, but can occur in any climate if immunity is weakened. Dry climates can dry out the skin, sometimes weakening protective barriers, but are generally less ideal for Candida growth. 3. Personal hygiene and lifestyle. Regardless of climate, managing moisture properly, such as changing clothes frequently and maintaining good hygiene, reduces the risk of candidiasis. Conclusion. Climate is one of the factors influencing Candida infection development, with warm and humid environments promoting its growth. However, immunity, hygiene, and other factors also play a significant role. Psychological impact and complications of Candida infection. 1. Psychological effects. Chronic or recurrent candidiasis can negatively affect a person's mental health, along with symptoms like headaches, fatigue, and dizziness. Patients may experience depression, anxiety, and emotional instability. Candida's enzymes and toxins can sometimes affect brain function, leading to cognitive impairments and difficulty concentrating, a phenomenon sometimes referred to as Candida brain. 2. Physical complications. Chronic candidiasis can weaken the immune system, making it harder to fight other infections. When Candida enters the bloodstream, systemic candidiasis, it can cause life-threatening inflammation and damage to multiple organs. Intestinal candidiasis can cause dysbiosis, digestive disturbances, and malabsorption. Cutaneous candidiasis results in redness, inflammation, and spreading skin infections. 3. Prevention of complications. Early and complete treatment of Candida infections is crucial, strengthening the immune system, maintaining a healthy lifestyle and psychological well-being, reducing stress, and ensuring adequate sleep are very important. Conclusion. Candida infection can impact not only physical health, but also mental well-being. Psychological symptoms and complications are more likely in chronic or systemic candidiasis cases. Dear viewers, that brings us to the end of today's video. I hope the medical information about Candida fungus, its symptoms, and treatment options was helpful to you. If you have any questions or personal experiences, please feel free to share them in the comments. We will definitely read them and try to respond in future videos. If you enjoyed this video, don't forget to like it and subscribe to our channel, so we can continue exploring many more interesting and useful health topics together. Wishing you health, happiness, and peace. See you next time. Goodbye. If you want, I can help you make this into a short script for your video outro as well. Would you like that?